Hello, everyone. For those who have just joined, this is our Choices Community of Practice July Coffee Chat. And I think we should get started since we have a lot in store for today. We'll let folks who just joined to say hello and introduce yourself in the chat. Please say your name, your organization, and title. So welcome. So I hope everyone is doing well today, finding ways to stay cool on yet another hot summer day here. And welcome to the Choices Community of Practice July Coffee Chat. The topic for today's coffee chat is communicating for change, strategies and tips for sharing public health science. My name is Jenny Reiner, and I am a project manager for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. School of Public Health. For folks who have joined our coffee chats in the past, it is my pleasure to be filling in today for our regular facilitator, Molly Garone. I do want to make everyone aware that we are recording the first part of today's coffee chat. You may have received a notification when you joined, and we'll be stopping the recording after our conversation with the guest speaker and before we open it up for a full group discussion. Next slide. Oh, there you go. That's good. As always, I want to acknowledge our funders who make our work possible and also share that our Choices work and events are for research and educational purposes only. The intention for today's coffee chat is to provide information, tools, and resources to inform and educate, and we're not looking to influence any specific legislation. If you are unfamiliar with the Choices Community Practice and new today, we'll just briefly describe what it is. The Choices Community of Practice includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance efforts and address health equity. It is our goal to support these efforts by providing tools and resources and training opportunities. And our coffee chats are unique, informal opportunities to gather ideas, innovate together, and get to know each other better. So for today's event, we will start off with a few questions for our guest speaker, and then we'll be opening it up for a full group discussion. We encourage you to share any questions or comments in the chat throughout the session today. So for today's coffee chat, we'll be focusing on sharing tips and strategies to effectively communicate public health science and information about nutrition, physical activity, and health equity to various audiences. Our goals for this session are to explain the importance of knowing your audience when crafting messages and selecting communication channels, to share tips and strategies that will help you communicate public health science and information about nutrition, physical activity, and health equity to various audiences, and then to identify opportunities and resources that can support your communications work. We are really excited to be joined by Amanda Yarnell from the Harvard T.H. School of Public Health. Amanda joined Harvard Chan School in 2022 as a senior director for its Center for Health Communication, where she is preparing public health leaders to communicate credible health information in an increasingly fragmented world. In that work, she leverages 2 decades of experience in science and health journalism, media product development, and audience engagement. Prior to joining Harvard Chan, Amanda worked as a science journalist and a newsroom leader at Chemical and Engineering News, an award-winning nonprofit science news outlet published by the American Chemical Society. She holds a Bachelor of Arts in Chemistry from Johns Hopkins University and a Master's of Science in it from MIT. So welcome, Amanda. It's so great to have you here with us today.
Thank you. It's lovely to be here.
Great. So Amanda, we're so happy to have you here with your expertise and background in communications. And we're interested in learning some tips and strategies for improving our communications to different audiences. So to start us off, could you share with us a little bit about why it's so important to identify kind of who your audience is and what's important to them, and then how that can be helpful for crafting your messages?
Yeah, I mean, not every audience is the same. right? We all come to every conversation with different background, different expectations, different needs. So tailoring your audience tailoring your message to your audience is critical if you want to break through and move people to action, whether your audience is your community members, as so many of you said in the poll, health agencies, colleagues, elected officials. This really applies to everyone. So the first thing I would suggest is, really thinking through who you want to reach, and then really thinking carefully about what's important to them. What kind of information do they want? Do they need to make decisions? Listening is the key there. That could look like a conversation with a colleague if it's colleagues that you're trying to influence and communicate to, but it also could look like, if it's the community, for example, user interviews or community forums, or even some kind of feedback suggestion box, whether that's like in real life or digitally in some way. It could also be listening to what they talk about on social via some sort of social listening tool like Sprout Social, things like that. Or thinking about what they're searching for via search tools like Google Trends, which you can tailor geographically, or something like Answer the Public. And in most cases, it probably should be both of those things. Then I would suggest that you think about tailoring your message so that you are centering their needs when delivering your information. Really think about what they're asking and try to answer that, through your lens, versus trying to push out what you think that they need to know. And then finally, don't sleep on delivery. Think about how you can meet them where they are. How do they want to get the message? Where would it be most useful? And when might they be most receptive or most in need of that information? Then try to insert yourself in that point.
Great. Thanks, Amanda. That's really helpful. Kind of knowing who your audience is and then figuring out what message will resonate based on really knowing what they need and then getting that message to them. Great. So maybe building on that, we often hear in our work how it's important to use data to help make your case. In our choices work for our project, we do a lot of research and we get lots of data on the cost effectiveness of different programs and policies that are aimed to promote healthy eating and active living. So do you have tips and suggestions for how folks can use data, like different facts and numbers and statistics in your communications?
Yeah, I mean, evidence is incredibly important, and to tailor your communications around it is really something I would advise. But I do think in many instances, people try to drown the audience with data, right? This is especially true with the broadest possible audience, but it even can be true with an expert audience as well. My recommendation would be to zero in on one, maybe two key data points. Less is really more when it comes to data. If you overload them, people tune out. So really think about what data point could you offer that really illustrates your key point. This should be like part of a story, not just a data dump, right? Present the message and then use a number to support that message. It's going to make sure that you've thought through that larger story that the number is meant to illustrate, because people are going to remember not the number, but the story that you wrapped around it, right? So another thing I would suggest is thinking about whether you always pick numbers that illustrates the scale of the crisis that you might be facing or that you want to tackle, and thinking about whether there's an opportunity to reframe that to illustrate the opportunity or the solution. Another thing that we used in my newsroom quite a lot, and there's a lot of data and I think journalism in general showing this, is that trying social math, right? So especially in science journalism, describing some very complicated concepts in general. I think the same is probably something you all have to grapple with on a day-to-day basis. So think about how you can convert your like very big number into a thing that people could actually wrap their minds around, that they could visualize. But of course, in that situation, you do have to choose your metaphor wisely. But that whole packaging is, again, going to what's going to help people remember what you're trying to convey, right? And wrapping a story around it is the key.
Great. Thanks, Amanda. That's really helpful. I'm not that familiar with the term trying social math, so that's a good new tip for me. And I do appreciate kind of the idea of what you said about people remember the story, not always the number. So that's good tip to also keep in mind as we move forward. Great. So my next question for you is that, and oftentimes we find public health science and research can be very complex and hard to communicate simply. We saw some of these challenges around the COVID-19 pandemic and vaccine communication. And another area where we often see some challenges is around conveying the importance of focusing on social determinants of health and how they can impact health outcomes, and also ways that we can prioritize our equity considerations into decision making. So what tips or recommendations do you have for participants on how we can communicate these more complex ideas and information to different audiences?
Yep. So when you use public health jargon, it's always really smart to think carefully about the audience that you're trying to reach, and is that language that you're using tailored to their needs? So if you're trying to reach a broad audience, maybe your wider community, and they don't have deep experience in public health or in prevention work, it would be wise to consider whether there are ways to say what you mean more plainly in terms that your audience is used to hearing. So I think a lot of people, that's can be hard to do because these are terms that mean something to us and we want people to understand. And so you see, I think a lot of people in a lot of fields thinking about, okay, well, maybe I should define this term before I use it. And that can help. But remember, it still requires more effort on your audience's part to follow along. And that can be a barrier to understanding and engagement. So for example, for many people working outside the field of public health, the very term social determinants of health, as important as it is, the term itself is not necessarily something that people are familiar with. And some could even suspect that it has something to do with socialism or a lack of free will just because of the words and their individual other meanings in our vernacular. So if you're trying to reach that broadest possible audience, consider whether there might be a plainer way that you could get your point across. So something like what surrounds us shapes us, or the essential conditions for community health. Equity is another example, incredibly important to everything that we do in public health. But outside of public health, it's often thought of as a financial term. So for a really broad audience, try, maybe a plainer alternative like fair and just. This is not to say that there aren't audiences where you would want to use terms like that, especially like with, say, your colleagues within your institution. That recommendation might not, need apply. But, again, I go back to what we discussed in the very top of this conversation. You always need to think about who your audience is and what they need, and then tailor your message accordingly. And this is part of that level of jargon that you use in your language choices. The second point I would make is about thinking about, again, how to tell stories, right? Back to what we talked about with the data. Of course, what kind of stories matter. So here, especially when we're talking about equity, social determinants of health, these kinds of issues, one thing I would recommend, based on the evidence in the science communication literature and health communication literature, is to think about how you can highlight structures and not people's struggles, right? So tell stories that help people see that it's systems that we need to fix, not people who are the problem. Another kind of story that's important is thinking about describing the future you want to see, right? So to avoid the feeling of, oh, that's just how it is, nothing's ever going to change, right? This kind of story, when you talk about the kind of future we could have in the if we work together, can be an antidote to that kind of fatalistic thinking, right? So think about what could have done to prevent this. How has our action or inaction led us here, and how would the intervention that you're proposing change things around you. So that's another good kind of story to think about. And then the third storytelling suggestion I would make would be around thinking about telling stories that are focused on the circumstances that lock people into, say, unhealthy food choices and out of opportunities that support active lifestyles. That's, again, coming back to the highlighting the structures, not struggles example I used earlier.
Great, thanks, Amanda. Those are really helpful tips and examples for that question, I think.
Yeah.
Continue.
And then I saw, before we moved on to the next question, I see in the chat that somebody had asked for an example of social math in practice. So one thing, this is around prevention and nutrition, for example. So thinking about maybe instead of talking about a finite number of calories you're supposed to take in during a day, changing that to something that somebody would actually, buy or use, or like, right. So the number of calories and fat in, say, like buttered popcorn or something like that at the movies, like something that would be in their daily life. Got it.
So putting something in more understandable terms, these more abstract things that aren't usually. Okay.
Mm-hmm. Think about the units that you're using, and are there units that are going to mean something to them in their daily life?
Great. So thanks for sharing that. I was just about to ask to expand on that. So thanks, and let us know in the chat if more examples would be helpful. If others have examples of using social math in your work that you think would apply, welcome folks to share those in the chat. Great. Well, I think for our last question for you before we kind of turn it over to the full group discussion is on the topic of prevention. So our Choices work is focused on obesity prevention and chronic disease prevention. And most of the policies and programs that we evaluate are focused on children and creating healthy environments for children to eat healthy and move more. And we sometimes struggle with how to communicate the value of investing in prevention. So how do you address and lift up the importance of prevention when often the benefits of these programs and policies are not seen or felt until much later? So kind of tips and strategies for how do we communicate the value of or the urgency for investing in prevention?
Yeah, it's a microcosm of, I think, challenges in public health as a whole. So a few things I would suggest. One would be to think about how you can connect action now with outcomes later. It goes back to that sort of storytelling suggestion I made earlier about imagining and talking about the future you could see together. So like, what could we do right now, and what would that look like later? Another thing that communications research has shown really does like change minds and trigger behavior change is talking about legacy, right? How can we leave behind something positive and meaningful for our children and grandchildren? So how could you make choices for yourself that would impact your children, your grandchildren, or how can we do that together for a whole community? In general, thinking about solutions in your area would be another way. I would think about this. This has been a trend in the last 10 years in the journalism space that I've been working in. More and more you see people really focusing on solutions in an effort to do this, to invest, to make choices that are good for a future that's not here yet. And if you're thinking about how that might play out in your area, one place I would recommend is the work of Harvard Public Health Magazine. And I think we can probably drop that in the chat, the link to that, how to subscribe. But they talk about public health solutions on a regular basis, what works, what doesn't, and why. And it might provide inspiration for you in your particular work. And then the final thing I would suggest is thinking about how you could shift from, you benefit or I benefit to we benefit as a whole, right? And then also thinking about how you make it the benefit is now to we benefit down the line, right? Can you describe some kind of forward exchange that might make people more willing to support prevention?
Great, thanks, Amanda. Those are helpful. And Angie popped that link to the Harvard Public Health magazine in the chat. Great. Well, thank you, Amanda. I want to make sure we have time for folks to submit and answer any questions. I know we have things in the chat already, but it was very helpful to hear all of your suggestions and tips for how to identify audiences, figuring out what's important to them, ways that we can include data and use plain language, tell stories, and really keep that positive framing, focus on solutions, and incorporate equity into our communication. So I think we touched upon a lot of different topics, and we can dive into some more examples and hear from you all on ways that you've worked on these different tips and strategies, as well as we move into our full group discussion. But before we do, we did want to share a couple of resources in the chat that may be helpful. One is the Center for Health Communication's Call to Action newsletter. This is a newsletter that Amanda and her team sent out. So we'll pop the chat, a link to that in the chat and allow folks to sign up. We will also share a messaging guide that our team has put together for investing in prevention. So look for that as well in the chat. And then we also thought it'd be helpful to share several of our research briefs that we've worked with state and local health departments. So we've worked with a bunch of different state and local health departments across the country to evaluate the cost effectiveness of different interventions. And we've created 2-page briefs summarizing these results, and they may be a helpful resource to see how some of these results and cost effectiveness results have been framed in these types of briefs.